Anyone working in a hospital loves to say this phrase, and we all agree on this. Prevention is better than cure, and it's cheaper too. In fact, preventing future illnesses and preventing complications from existing conditions are vital to the future sustainability of the entire healthcare system. So vaccination is one good example. Yet, when it comes to dealing with Philhealth claims denial, the opposite thinking occurs in many hospital staff. The phrase, prevention is better than cure, it's cheaper too, does not exist in claims processing for many hospitals. Now, if you or your hospital staff will understand this key concept and at the same time act on it, your hospital Philhealth claims income will potentially increase. Hello, my name is Coach Doc Ben. I was a former Philhealth claims chief. I am the founder of UHC Clinical Claims Consultancy. We teach hospitals in decreasing their claims return, decrease their claims deny, and increase their Philhealth claims income. So if you are serious in Philhealth claims reimbursement, this video is for you. And if you stay till the end, you will discover that you can save millions worth of pesos if your hospital claims processing practice prevention is better than cure. Now, if you think this topic is useful for you and your hospital, and if you wish to know more on Philhealth concepts like the Claim Form 4, universal health care, no balance billing for private hospitals, please smash the like button and subscribe to this channel. And let us proceed. So, prevention is better than cure, and it's cheaper too. So the same concept applies in hospital claims processing. Prevent Philhealth claims denial. So in my almost 15 years experience in Philhealth, most hospitals focus on claims collection. They do not focus on hospital Philhealth claims training. Many hospitals never teach Philhealth concepts among their doctors, nurses, and practically all the hospital staff. So here's the thing. Many hospitals do not prioritize efforts in preventing claims denial, despite the fact that 90%, again, 90% of denials are basically preventable. So it doesn't make any sense, especially at a time when financial resources as well as human resources are often scarce. Okay? Now, hence, many of denials are never reworked, creating or eventually lost revenue. Now, to maximize revenue and to minimize administrative cost, especially in an era of shrinking margins, you have pandemic-related expenses. Healthcare organizations need to adopt strategies that will help them discover the root causes of claims denial so you or they can avoid them. So most of the time, denial issues results from information that is either missing or erroneous due to inefficient manual process or human error. So here are the most common sources of denial and basically how to solve them. So first, we have provide medical necessity or admissibility. Now, while it seems very simple, or in fact it's common sense, Philhealth rules on what qualifies as a medical necessity are actually quite tricky and at the same time slippery. So Philhealth will reimburse only if the documentation is clear, concise, and proves there is a demonstrated medical necessity to admit the patient based on clinical symptoms that matches the diagnosis. So, to simplify, Philhealth is just asking for the reasons of admissibility. Doctors need to present the case of the patients meeting the criteria for medical admissibility. So diagnostics and laboratory results must be present to substantiate medical necessity of admission as well as the necessity for surgery. So these are extremely helpful in reducing the source of denial. So what do I mean? So if your patient was admitted due to community-acquired pneumonia moderate risk, make sure you capture and indicate the signs and symptoms that will warrant admission. Let me repeat that. You need to capture and you need to indicate the signs and symptoms that will warrant the admission. So make sure you have imaging or chest x-rays that will show that the clinical management is on track. So the absence of admissibility signs and symptoms as well as the imaging may lead to the denial of claim. So the same thing in surgery. If you do a cholecystectomy or probably an appendectomy, make sure indication for surgery with specific imaging or laboratory results are documented. Now, I have a former hospital client lost at least 2 billion pesos due to this issue. So the hospital admits patient. Don't get me wrong, the patients are 100% sick, but their claim were denied. The reason for denial was the absence of signs and symptoms in the chart and also in the claim form 4. So apparently, the doctor, or rather doctors, failed to write a good history and a good physical exam. The signs and symptoms were not written. So, documentation was not poor. Documentation was worse. Now, let's go to the next issue. Doctors are not trained in Philhealth rules and concepts. So, by now, you will agree that Philhealth is a very dynamic organization. Rules and their policies are evolving time to time. And even their officers are changed time to time. Now, doctors are the main source of clinical information that is required in the claim form 4. So, Philhealth reimbursement is based on the completeness and the correctness of clinical information written in Philhealth forms. Now, in my experience, hospitals lose millions or ends up in Philhealth legal due to incorrect clinical information. So basically, the continuous changes in Philhealth policies plus the doctors' lack of awareness in Philhealth concept leads to the recurrent return or the recurrent denial of hospital claims. So hospitals must educate or train doctors on Philhealth concepts. So I have a related video on this. So just click the link here. So the last issue is removing human error. So manual processes introduce possibility of errors. Something as simple as incorrect age or transposing two numbers in an address or forgetting to fill out basic field in the form can result in a denial that must then be managed. So, information technology that automatically fills in or automatically writes the basic repetitive information eliminates the source of denial by starting them as clean claims. So, once the patient information is locked down, more sophisticated systems can also provide a double check to ensure no information is missing and that the claim is clean and the claim is accurate. So, other systems may even have the ability to compare the current as well as the past claims, enabling them to flag those that have potential for a denial based on past experiences. So, in summary, if you are serious in Philhealth claims processing, you can prevent Philhealth claims denial. My friends, prevention is better than cure. It's cheaper too. The same concept applies in hospital claims processing. If done efficiently, this will potentially increase your claims revenue. So I hope you were able to get that. So if you like this video, tell me what you like about it. If you have specific claims topics you want me to discuss, just post a comment in the section below. If you want to learn more on Philhealth rules and concept, please subscribe in this channel. This is Coach Doc Ben. See you in the next session.